Doctors of Reddit, what's your weirdest case of a patient accurately self-diagnosing? I had a patient who predicted her own death. She was a relatively healthy 90-year-old with hypertension and diabetes. She woke up that morning, told her daughter that she was going to die. She made her daughter go to a lawyer's office and sign a living will, confirming DNR/DNI. That evening she had a massive heart attack and was rushed to the ER. We tried medical management, but per her wishes per he living, well that she signed like 6 hours earlier. She did not want any invasive measures she died about an hour after she came in. My dad, who is a great person, but also occasionally an asshole, took my 3-year-old sister to the ER with the flu. Thing is, there was a meningitis outbreak in the area, and the ER was packed. Dad, being an ass, tells the nurse he is suspecting meningitis to bump us to the top of the list. The doctor is pissed because she has no meningitis symptoms, no stiff neck, no fever. They get into an argument. He orders a spinal tap since dad is concerned. Dad will not back down at this point, and it comes back positive for meningitis. Had a patient who yelled code blue really loud from his room. As we all rushed into his room, his heart stopped. He didn't die that day, fortunately. During my second lung collapse, the doctor was adamant that it was just a panic attack. Since it felt exactly like my first lung collapse, I kept insisting he take an x-ray. After the x-ray results, he said against all probable odds you were right and I had a tube in my chest within the hour. Every time I pee outside my shop, the bees come and land on it. I think I might have diabetes, he did. Went to the same emergency room twice explaining that something was fricked up in my head. They diagnosed me with anxiety attacks both times. Had stroke 2 days later. I went to her several times for weird dissociative head stuff. They brushed it off as anxiety attacks every time. 6 years after the initial episode, a doctor finally ordered a CT scan that revealed a slow-growing brain tumor. By this point it was the size of golf ball. The pathology report approximated it had been present for 10 to 15 years. I guess technically they were right every time they told me it was all in my head. So some backstory. Not a doctor, but really who is in this thread. In 6th grade my best friend had his appendix burst in the middle of the night. After hearing about it, I was utterly terrified of it happening to me. My parents and doctors all told me it is relatively rare, and if it did happen there isn't really anything to worry about. I asked what it felt like if it did happen, and they said oh, you'll know, yay thanks, really helpful. But my appendix bursting became somewhat of a phobia of mine for over a decade. Every time I felt abdominal pain or severe gas I always jumped to the conclusion of appendicitis. So about 10 years later I'm hanging out with my friends when I start to feel some bad gas pressure coming on. Nothing too bad, but nothing would really make it go away. After I got home it was still rather bad, but I figured I'd just sleep it off. Woke up at about 5 AM curled into a ball throwing up on my pillow. At this point, I was still living at home with my parents, so I hobbled my way to their room and woke them, telling them I think my appendix was going. They told me it's probably gas, and are you really sure we should take you to the ER? I told them I was sure it was my appendix, and they sort of told me to wait it out until 7, when they could phone the family doctor. So I curled into a ball in the bathroom and threw up for a few hours. At 7 on the nose they called the doctor and I described my symptoms, and the doc told my parents to take me to the ER now. So we get to the hospital, and I'm walking so hunched over my face is almost at my knees. Bring me into the ER, and they order a CT scan, think it was a CT, was kinda out of it, and put me on some killer anti-nausea pain meds. The endoscopic surgeon comes in with my CT scan and tells me, verbatim, this is the most clear-cut case of appendicitis I have ever seen, and asks me to sign a release, because he was going to film the operation endoscopic bits at lead for training materials. So long story short, I had appendicitis. I knew it, and it was so clearly appendicitis that the doctor wanted to film it to teach other surgeons. So for any aspiring endoscopic surgeons in the thread, maybe you get to see inside me. Not a doctor, but a chronic patient. I have a rare neurological disease that causes tumors to grow on the nervous systems and on any other type of body tissue, but the nervous system tumors are most common. I was diagnosed at age 4. I've been treated by the same clinic for over 25 years, having seen the same specialist for 20 of those years. The hospital where I'm treated is more than 3 hours away, but my local hospital is affiliated with them. I woke one morning with severe hip pain, swelling in my thigh, and a terrible limp. I went to my small town where I was told I had a skin infection. Doctor just visually examined me, ran no tests, and told me it was razor burn from shaving my bikini area. Was giving an antibiotic. My disease is in my medical records, which the hospital had access to since it's the same medical facility, just different locations. 2 days later, the entire inside of my thigh had turned purple and blue. I couldn't walk without excruciating pain. I went to an express care like a step down from the ER. They immediately sent me to the ER for symptoms of a blood clot. The on-call doctor notified the ER I was coming, demanding an ultrasound. I arrived back at the ER, where the ER doctor basically told me she wasn't ordering an ultrasound because it wouldn't find anything, was told the bruising was self-induced to get pain pills, and that I was being discharged and blacklisted. My husband flipped shoot and demanded an ultrasound, threatening legal action if not. Dumb doctor gave me attitude, but eventually ordered the scan. The ultrasound tech turned white as a ghost, quickly turned off the monitor, and rushed to get the drive. Turns out I had a tumor the size of a 12 ounces soda can growing off a major nerve in my groin. I somehow strained the muscles around it, damaging my nerve and muscle. Never got an apology or admission of being wrong from the doctor. My specialist later told me she had a lot of fun talking with the ER doctor with heavy sarcasm. Not a doctor, but a patient. I woke up one morning with a severe pain in my side and I instantly knew I had a kidney stone. I'd passed one before. I'm a female BTW. Couldn't get into my regular doctor, so I made an appointment with the first guy, who was available to hopefully get pain meds to make passing it a little more bearable. I go in to see him, and he is hands down the most arrogant and condescending doctor I've ever seen. When I try to explain to him that I know it's a stone, he tells me that, since I was able to walk into the office, I don't have a stone. If you had a kidney stone, you wouldn't be able to move past the stone 2 days later without medication. What an asshole. Not a doctor. I self-diagnosed rhabdomyolysis, had the whole Coca-Cola colored pee thing, and went in and explained to him that I thought I had it, couldn't pronounce it, wrote it down and showed him. Doc kinda laughed a little, said, "Man, this internet thing is not doing anyone any favors." This was in 2005. He says, "Pee in this cup, so I can prove to you that you don't have it." I pee in said cup. He takes a look, says, "Wow, I don't even need to check this under a scope. I need you to go there right now. Don't go home. Someone can bring you stuff later. Go there right now. I'm calling them. They will admit you as soon as you show up." Sure enough, spent 3 to 4 days in the hospital with constant fallopian fourth drip, having to measure all my output until some level creatinine got back into normal levels. Apparently mine was like 1000x higher than it should be. How did I get this horrible thing, you may ask? I went to a gym, told the guy I have never really worked out before, but I'm getting older and need to get in shape. Turns out, when you are a younger athlete and stop working out, you might still be able to go at it harder than your body can handle, and you break down way too much muscle fiber and end up clogging your kidneys. Yay. Sorry, I'm not a doctor, but last year, when my daughter was 3 months old, she stopped eating and pooping. Then she started getting weak and limp, and it got to a point where she couldn't even open and close her mouth and eyes. Her doc said she was dehydrated and put her on an 4th overpass. The next morning, she was worse. How are you worse, but not dead yet? IDK. Anyway, I read an article that was meant to be a riddle for medical professionals, and the riddle described my baby to a T. Most of the commenters guessed infant botulism, so I suggested it to the pediatrician that came in the next day. He said no, she's probably still dehydrated. That immediately made no sense, and she'll be fine. We can go home. Mind you, we live in NJ and this was in NC. We were on the way back home from a road trip to FL. I wasn't having it. We asked to transfer to a children's hospital. The docs there did every test they could think of, and nothing was coming up. I begged them to test for IB, and gave them full permission to laugh at my lack of medical expertise, and since they already tried everything else, they obliged. It was IB. The first case that hospital had seen in 20 years I think. The residents on her case wrote a paper about her. Had a patient at the ICU on a ventilator because of rapid lung fibrosis. Usually it's triggered by medication or an outside trigger, pets, feces of pets, etc. We stopped one of his cardiac medications, which is known for being able to cause this kind of syndrome, and the progression of his disease stopped. We told his wife and she said, yeah, I knew. And I knew it was this particular drug. The dog told me. We were shocked and asked her to explain. She told she had been feeding the different drugs of her husband to the dog over a period of 2 weeks, every day a different drug, and he had started barking when she fed him this particular drug. For 16 years I complained about severe pain, loss of blood, listlessness, and extensively long periods. We're talking 13 to 17 days. I kept getting told that it's normal, I'm exaggerating, it can't be that bad, I must have a low pain tolerance, etc. I tried every single form of birth control over those 16 years. In 2008 I had exploratory surgery since my gyn couldn't figure out what was wrong. Turns out that I had severe ovarian torsion, which they repaired, and they also found quite a bit of endometriosis and removed it. I still had heavy long periods, but the pain wasn't as bad. Then the pain started coming back in 2015. After several trips I finally get an appointment with a new gyn. I said I was tired of this crap and wanted a hysterectomy. She said before doing something so drastic, she suggested trying an IUD. So, I did the Mirena IUD for a year and got such bad depression from it, I wanted to kill myself, on top of horrid pain anytime I had sex, and with months of constant bleeding. Then this past June, my gyn agreed to do a hysterectomy. I was full of endometriosis, adhesions, and cysts. I was having bladder incontinence problems because my bladder was completely surrounded by the endometriosis. Now I'm 3 months post-op and so glad to be free from all the pain and bleeding. Plus the bonus of never having to worry about an unwanted pregnancy. I was 9 when I fell off of my bike on a family bike ride. I was screaming like crazy, say my leg was broke. My parents thought I was crying wolf and told me to walk it off. When I wouldn't shut up, my dad carried me to the parking lot while my mom got the car. I remember my dad telling me to put my leg in a position if I truly thought it was broken, but he was still skeptical. Lo and behold, when we went to the ER to get an MRI, my leg had a spiral fracture. So I fell out of the top bunk on vacation and broke my leg on the lower metal frame. A doctor said I couldn't possibly have broken it, and I was just trying to score pain meds. Here's proof. I walked in. 4-hour car ride back home. My regular doctor puts me in his own car to drive me to the hospital, where the swelling on my leg is now too much to cast. Original doctor paid all my medical bills and was reviewed by the state board, where it was discovered he had been drinking on the job. Lesson 1. You can walk on a broken leg. Lesson 2. Don't be a dick. Picked up a long-term patient at county hospital who was both epileptic and schizophrenic. And she told me her history with incredible insight and understanding. The reason she was there was because she was on Dilantin and meds for her schizophrenia. So she said, this is what happens. I'm taking all my meds, but I begin to cut back a bit on the stelazine for schizophrenia. Then I get a bit more paranoid and figure I'm being poisoned with the Dilantin. So I cut back on that and have a seizure. That cures my paranoia for a while and start taking my Dilantin and stelazine again. But then I get paranoid and stop taking as much of the one or the other. Then get more paranoid, stop my Dilantin, get a seizure and end up in here. She knew exactly what was going on. Incredible insight. And her records showed she was right. Incredible insight into what was happening, but completely powerless to stop it either. The seizures made her sane a while, and things would balance out, and finally a few times a year she'd end up in hospital, because it would get out of control.